Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Orgasmic dysfunction in women. Introduction. An orgasm is a feeling of intense sexual pleasure and release of physical tension. About 1/3 of women have problems having orgasms at some points in their lives. This is known as orgasmic dysfunction. There are many possible causes of orgasmic dysfunction. If you are unable to orgasm, or if you are bothered by how long it takes you to have an orgasm, sexual health education or medical treatment may help. This program explains orgasmic dysfunction in women. It covers causes of sexual problems and treatment options. Anatomy. This section reviews the anatomy of the female sexual organs. The external part of the female sex organs is called the vulva. It includes the vaginal lips, clitoris, and the openings to the vagina and urethra. There are two sets of vaginal lips. The outer lips, which are called labia majora, and the inner lips, known as labia minora. They are both sensitive to stimulation, but the inner lips are more sexually sensitive. The clitoris is the most sensitive part of the female genitals. For most women, stimulation of the clitoris is needed to reach an orgasm. The clitoris is located above the top part, where the inner lips meet. It is partly covered by a hood. The openings to the vagina and urethra are also part of the vulva. The urethra is a tube that carries urine out of the body from the bladder. The urethral opening is inside the vestibule and under the clitoris. The vestibule is the name of the area within the inner lips. The vagina is a muscular tube. The vagina is a passageway that leads from the external genitals to the cervix and the uterus. The vagina provides a path for menstrual blood and tissue to leave the body during a woman's period. The vagina is also called the birth canal. During childbirth, babies are delivered from the uterus through the vagina to the outside of the mother's body. Inside the vestibule and vagina are glands that make lubrication when a woman is sexually aroused. This moisture allows for smoother penetration during sex. The pelvic floor muscles are layers of muscle that are attached to the front, back, and sides of a woman's pelvic bone. They contract when a woman is sexually excited. The muscles release their tension during an orgasm. Sex and orgasm. An orgasm, or sexual climax, is a feeling of intense physical pleasure and the release of muscle tension. The way an orgasm feels varies from person to person. The same person may have orgasms that feel different in terms of intensity and how long they last. During an orgasm, the brain releases chemical substances. These substances cause intense feelings of pleasure. In women, an orgasm happens along with involuntary contractions of the pelvic floor muscles. The way an orgasm feels may change with age, due to a medical condition or illness, while taking certain medications. Before reaching orgasm, women usually go through two stages: sexual desire and sexual arousal. Sexual desire is also known as libido. Arousal is the act of becoming sexually excited. The clitoris, vagina, and cervix send signals to the brain when they are sexually stimulated. Blood rushes to the vagina and clitoris, which causes the feeling of arousal. The clitoris may fill with blood. In women, arousal also causes a faster heart rate, increased breathing speed, hardened nipples, the walls of the vagina to make lubrication. Most women need stimulation of the clitoris in order to have an orgasm. Some women have orgasms during vaginal intercourse. Women vary in the amount of stimulation they need to reach climax. They also differ in how frequently they can have orgasms in a short period of time. Muscle tension is often needed with sexual stimulation for a woman to have an orgasm. Many women tense their legs, abdomen, and buttocks in order to reach climax. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Orgasmic dysfunction. About 1/3 of women have problems having orgasms at some point in their lives. Sexual problems could be related to a lack of libido, a lack of arousal, or a condition known as orgasmic dysfunction. Orgasmic dysfunction is the inability to reach orgasm or difficulty in reaching it when there is no problem with libido or arousal. It happens when a person is not able to reach sexual climax or cannot reach it easily. The main symptom of orgasmic dysfunction is a long delay in reaching orgasm or not being able to reach it at all. There are different types of orgasmic dysfunction. Some women have never had an orgasm before despite sexual stimulation. This is known as primary orgasmic dysfunction. Secondary orgasmic dysfunction means that a woman used to have orgasms, but now it is hard for her to reach climax. Some women are able to have an orgasm only in certain situations. For example, a person may only be able to have an orgasm during masturbation. This is known as situational orgasmic dysfunction. Talk to your healthcare provider if it is hard for you to reach orgasm or if you are unable to climax in certain situations. Causes. There are many causes for orgasmic dysfunctions. It can be caused by medical conditions, medications, or mental health conditions. Orgasmic dysfunction can also be caused by lifestyle issues or relationship and communication problems. Orgasmic dysfunction can be caused by certain medical conditions, such as hormonal changes, diabetes, and neurological diseases. Previous surgeries or conditions that affected a woman's genitalia or reproductive organs can affect her ability to have orgasms. Many over-the-counter and prescription drugs can affect a woman's ability to have an orgasm. Common drugs that can cause orgasmic dysfunction are antidepressants, antihistamines, blood pressure medications. Mental health problems such as anxiety and depression can affect a person's ability to have an orgasm. Past traumas such as rape or abuse may also cause orgasmic dysfunction. Normal body changes can affect your sexuality as you age. For example, changes during menopause can decrease feeling in the clitoris, nipples, skin, and vagina. Alcohol and drug use may cause orgasmic dysfunction. Pain during sex may also cause orgasmic dysfunction. Many psychological causes can affect the ability to have an orgasm. For example, cultural and religious beliefs about sex or fear of pregnancy or sexually transmitted infections can affect the ability to reach orgasm. Stress and life pressures can cause orgasmic dysfunction. This is usually temporary and goes away when the stress is managed or stopped. Relationship issues can affect a person's ability to reach sexual climax. Conflict or a lack of trust may make it hard for a person to have an orgasm with their sexual partner. Poor communication about sexual preferences and needs may also prevent a person from being able to have an orgasm with their sexual partner. Diagnosis. Occasional problems with sexual function are common. Contact your healthcare provider if you are bothered by a lack of orgasm or by how long it takes you to have an orgasm. Your healthcare provider will ask you questions about your personal and family health history. He or she will ask about your sexual history and your current sexual relationships. Everything that you say to your healthcare provider is private. Your healthcare provider may ask you the following questions. When did you first become sexually active? Have you had orgasms in the past? How, where, and when did you have them? Do you use alcohol or drugs? If you have a sexual partner, your healthcare provider may also ask, do you become aroused during sex with your partner? How satisfied are you with your current partner? You may also be asked to answer the following questions. Are you a survivor of rape or sexual abuse? What are your religious and cultural beliefs about sexuality? Your healthcare provider will also perform a physical exam. They may examine your genital area. Some medical tests may be needed before a diagnosis can be reached and a treatment plan is recommended. Treatment. Treatment for orgasmic dysfunction depends on the cause of the condition. If a medical condition affects your ability to reach orgasm, treating the medical condition may help. If orgasmic dysfunction is associated with menopause, estrogen therapy may help. Your healthcare provider may give you a pill, patch, or gel that contains estrogen. It can also come as a topical cream or ring that is placed in the vagina. If medications affect your ability to have an orgasm, your healthcare provider may be able to suggest alternative medications or change the dose you take. Talk to your healthcare provider if the medications that you take affect your sex life. A variety of other treatments can benefit women with orgasmic dysfunction, including sexual health education and sex therapy. Sex health education can help you learn different types of sexual stimulation to try to help you reach orgasm. You may be taught how to touch your body in different ways when you are alone and when you are with your partner. Most women need direct or indirect stimulation of the clitoris in order to have an orgasm. Switching positions during sex may help. Touching yourself during sex or letting your partner touch you may help you reach orgasm. Using a vibrator during sex can also help. Sex therapy can help treat orgasmic dysfunction. Sex therapy includes behavior exercises, help with communication skills, sex education. If orgasmic dysfunction is caused by psychological or relationship issues, addressing them and related stresses can help prevent symptoms of orgasmic dysfunction. Talking to a counselor may help. Talk with your healthcare provider if you have any concerns about your sex life or your ability to have an orgasm. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. An orgasm, or sexual climax, is a feeling of intense physical pleasure and release of tension. During an orgasm, the brain releases chemical substances which cause intense feelings of pleasure. In women, an orgasm happens along with involuntary contractions of the pelvic floor muscles. About 1/3 of women have problems having orgasms at some point in their lives. This is known as orgasmic dysfunction. The way an orgasm feels varies from person to person. Women vary in the amount of stimulation they need to reach climax. Some women have orgasms during vaginal intercourse. Most women need stimulation of the clitoris in order to have an orgasm. There are many different types of orgasmic dysfunction. The major symptom is a long delay in reaching orgasm or not being able to reach it at all. There are many possible causes of orgasmic dysfunction. Orgasmic dysfunction can be caused by medical conditions and medications, certain mental health conditions, alcohol and drugs, relationship problems. Occasional problems with sexual function are common. They may be related to a lack of libido or an inability to get sexually aroused. Contact your healthcare provider if you are bothered by a lack of orgasm or by how long it takes you to have an orgasm. Treatment for orgasmic dysfunction depends on the cause of the condition. If a medical condition affects your ability to reach orgasm, treating it may help. If medications affect your ability to have an orgasm, they may be changed. A variety of other treatments can benefit women with orgasmic dysfunction, including sexual health education and sex therapy. Thank you for using Explain.